Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. It's the month of May, and we are celebrating Mental Health and Behavioral Health Month and awareness. So join us. Remember to share, share, share. Invite your friends and your family because health is wealth. Couch Conversations is on. We're going to go around as we usually do, and we're going to introduce our esteemed panel to you. The Congressman will be joining us shortly. We were in a meeting and we are all running. So he was left there and he'll be joining us shortly. I'm going to start with my coworker who is basking in the sun, but he still loves us anyway. That's my very own Dr. Douglas Graham. Dr. Graham.
Thank you, Nikki. I just want to let everyone know that I'm just following Dr. Hampton's recommendations. I'm getting my vitamin D naturally. I'm just not in Barbados. That's all. So I'm a retired physician.
As long as you are following the doctor's orders, then I have to agree with that. To the man who says that I threaten him to be here every Monday night, but he tends to be on time, that's our very own Dr. James Miller. Dr. Miller.
Oh, good evening, everybody. I'm Dr. James Miller. I retired from clinical medicine a couple of years ago, but I'm still trying to heal the community. And I'm so happy to be here on this forum to be able to have a conversation with my esteemed colleagues and also to learn as well and teach.
Outstanding, outstanding. To the urologist of the stars, but he never wants any accolades. But trust me, he has kept men very healthy. That's our very own Dr. Terry Mason.
Well, thank you very much, Nikki. And it's always a pleasure to be here again with a very esteemed panel. I'm glad to see our mental health representation here. This is really, really important, as Mr. Harrington calling me, actually. And I'm glad to be here. So I'm looking to learn a lot tonight from our esteemed mental health colleagues, because we have a lot of that we need to discuss. So thank you again, Nikki and the Congressman, for making this forum possible.
Well, thank you for being here with us. To the guy who's known for his purple and gold, and everyone refers to him by the initials of his name, that's our very own Dr. Donald Dew from HSI.
And good evening, everyone. Again, Donald Dew, President and CEO of Habilitative Systems, Inc. I'm just very, very pleased, Nikki, to report that, I've been at the helm of HSI for 32 years now. And it's been a labor of love. And, there's always something special to be passionate about in terms of interventions in the targeted areas that we serve. So I'm just happy to be here, happy to be with these esteemed colleagues. And, whatever we can do to uplift the community, you can always count on me to be here.
Thank you so much. Thank you, thank you, thank you. To the guy who is known for his black and gold, that fashion guy debonair, our very own Joel Johnson of TASC. Joel?
Thank you very much, Nikki. Thank you for having me. Wherever Donald is with the purple, I have to come with the black to cover it up a little bit. He got the gold right anyway. Joel Johnson, President and CEO of TASC, and happy to be here today.
Thank you so much. Well, Donald, I am sorry to do this to you, but that black and gold is just standing out today. However, this black and gold, his love is really to be Wolfgang Puck. He's the weight loss guru, that family medicine doctor who will get you healthy and will get you off meds if you just stick to the plan. That's our very own Dr. Tony Hampton. Dr. Hampton.
Hey guys, first of all, I didn't know we were gonna have a fraternity event tonight, but I appreciate it, and it's really amazing. When I was at Xavier in New Orleans, we had a phenomenal relationship between the fraternities. It was like amazing. So I missed that. For anybody that's young that's checking us out, or if you have a young person, college days swiftly pass, but I'm gonna tell you, they're beautiful memories. And please, if you have a young person that can experience that, encourage them to do that. I'm a family doctor with Advocate Aurora. I also put a little extra time into obesity, diabetes, and things like that. Very much interested in wellness. And I was fortunate at our local site to have our chief operating officer visit our site. His name is Bill Santulli. He was actually one of the founding members of Advocate of Rural Health, and just putting that bug in his ear about the importance of wellness in our health system was very important to me. So I'm happy to have that happen today. So with that, I'm very excited about tonight. This conversation is so important. Mental health is huge, and we need to just talk about it over and over again. So let's get this conversation started.
Well, right as we get the conversation started, we got to say hey to some people who are here with us. Want to say hi to Linda Johnson. She says, good evening, everyone. Gwen Butler is here. Hey, Gwen, with that ALC. Or is it ALC?
A1C. That's right. You remember.
Yeah. Hey, A1C. Hey, Gwen, girl, I am excited for you. That's why I get a little tongue-tied. I'm excited. And I hope that my weight loss journey is just as great as yours. So Gwen Butler says, good evening to everyone. Kimberly Dew is here. Hey, sis, how are you? She says, good evening. Lorenzo Burton is here. He says, good evening to everyone. Charles Edward Birmingham McDavid Sr., okay, is here. And he says, good evening to everyone. Good evening to everyone. Remember to join, and share. Well, Donald, we'll start with you. Why don't you give us a little history about HSI and tell us all about it and the great services that you guys have to offer. And then, Joel, that same question is posed to you. And once you guys do that, we'll start our conversation. Donald, you're muted. We can't hear you. You got a little purple and gold in your ear. There you go.
There we go. That purple and gold does have a profound effect. There's no question about that. And speaking about Louisiana, Dr. Hampton, my mother came migrated from New Iberia, Louisiana, to the west side of Chicago. I always say that, Mama was the first and most profound strategic planner I knew. She made the righteous decision to come up north, and I'm so glad that she did. And there's a whole lot I could say about that story, but I'll pause on that particular point. A little bit about HSI. Habilitative Systems, Inc. actually grew out of Clare Christian United Methodist Church. So we actually grew out of a faith-based movement right over on the west side of Chicago. Clare Christian Church is still over on Pulaski off of 16th Street in the North Lawndale community. And, when I came on board back in 1984, as a care coordinator for HSI, one of our board members by the name of Lois McCoy actually mortgaged her home to make payroll at HSI back in those days. I mean, just think about an elderly sister who was a member of Clare Christian Church actually putting her home up, so that a payroll could be made at HSI. There's so many stories like that about the souls of Black folk on the west side of Chicago and the commitment. It's been so powerful. And, HSI is grown and by leaps and bounds over the years because of people like that. We started with 3 programs in 1978, over 45 programs now, 15 different locations, over 100 staff, primarily providing services to persons with serious mental illness, substance use disorders, people with developmental disabilities, child welfare, children at risk. We've done restorative justice. We've built 160 units of housing on the west side of Chicago, 2 senior facilities and 5 facilities for people with disabilities. And one of the things that we've often talked about when folks say, well, it seems like you all are trying to be all things to all people. And I'm like, no, we're just trying to be responsive to community need. There's a lot of complex need out there. And, one of the things that we want to emphasize, especially during this month, is that, this mental challenge that we're facing as a people is not by accident. Generational trauma is real. My good friend, Dr. Carl Bell, talked about it all the time. He said, especially as we talk about our kids going to college, you got to understand, it's like all gas and no brakes. So, we also see a lot of mental illness happening at this stage, in their lives of going off to college. So there's so much that we can say here this evening for our college-bound children. And remember, society is judged by its treatment of its children and its elders. Our children and our elders are key if we're going to rebuild the social fabric of the society, as Dr. Bell talked so aptly about.
Thank you, Donald. Great comments. And, that West Side is definitely true to my heart. I know before we started, I told you I had a little Costner and Jackson roots, not too far from where you're speaking in terms of the origin. Loving all those programs. As someone who lived in that community, and someone who understands the struggles of that community. It's so nice to have an organization like yours is making this happen. In fact, ironically, Denise Campbell, who is commenting right now, was one of the people I worked with when I worked for Circle Family Care on the West Side. So I was right over there. She was doing her thing, and it's good to see her beautiful face and beautiful smile. So thank you for being with us this evening. So I guess we'll shift it over to Joel. Why don't you go ahead and introduce yourself?
Absolutely. So once again, Joel Johnson. I serve as the president and CEO of TASC, which is an acronym for Treatment Alternatives for Safe Communities. The original name of TASC 46 years ago was Treatment Alternatives to Street Crimes. And TASC was born, there's a little known law in Illinois that says if a person is arrested, they have a right to a screening and assessment to determine if they have a substance use disorder, and treatment could be aid in their defense, either as an alternative to incarceration or treatment to reduce their sanctions. And so TASC was born. TASC is a national model that was born out of the ONDCP, really the Nixon administration. But this law in Illinois helped TASC Illinois grow. So there are other TASC models across the country. Most of them are public. We are a private nonprofit, and TASC grew up alongside HSI and Bobby E. Wright. And I was previously the CEO of HRDI for 10 years prior to coming to TASC a year ago. These community-based behavioral health organizations responded, as Donald said, to the needs of the community. And so Donald and I have worked together, ribboning each other about our fraternal connections, but working side by side as our predecessors worked side by side over the last 45 to 50 years in their respective organizations, trying to build an infrastructure to better serve our communities. TASC is a licensed substance use treatment provider, but I'm happy to say that we have applied for our mental health license. For 45 years, we've been assessing and screening both mental health and substance use and making those referrals. So we don't provide treatment, we screen, assess, and refer. We serve all 102 counties in the state of Illinois, and we're happy to become a licensed mental health provider soon to be able to double down on the work that we've already been doing.
And I think about the screen, assess, and refer. One of the biggest struggles that we have always had in healthcare is that we didn't have anybody to screen, assess, and refer because the doctors are busy, their team members are busy, and God knows, where do you refer to? We're literally just starting to create a model within our medical record called EPIC, where if we have a patient who has a need, we now are partnering with organizations like yours and others that can then provide the services that people need. And I guess I'll start us off. I want my colleagues to chime in, ask questions.
Right before you start us off, we do have a question.
Oh, yeah, go ahead.
DJ asked the question, what is the difference between behavioral health and mental health? Okay. Now, don't all jump at that question at the same time.
I'll offer. I think there's a little bit of controversy in that terminology, but we've approached behavioral health as the intersection of mental health and substance use disorder, and so we often treat people with what we call co-occurring disorders. It may be chicken egg. Was it a mental health episode that someone began to self-medicate with narcotics or illegal drugs or alcohol, or was it a substance-induced psychosis that the use of substances caused the person to have a manic episode? So behavioral health, and for a number of years, Donald and I worked together in what is known as the Behavioral Health Consortium of Illinois. Is a consortium of 12 organizations that service the broader Cook County. It was the substance use treatment and the mental health treatment combined, or is what we use to define behavioral health.
Donald, you look like you got something to say.
Amen. I think he described it very well. And again, we don't have the luxury of just dealing with the persons, I say our neighbors, our friends, our family members in the community, one-dimensionally. There are multiple challenges, multiple issues that we're faced with. So very rarely do we encounter a person served with a single diagnosis of severe mental illness. Oftentimes there is a co-occurring disorder. And of course, there's also medical concerns around hypertension and diabetes. So, there are all these, and of course, we got to look at poverty. We got to look at trauma. We got to look at violence and all these other issues and factors that we're calling social determinants of health that impact upon the people that we serve. And by the way, let me also just say, it's not just the people that we serve, it's also the people that do the service. 9 times out of 10, over half the people that work at HSI reside on the west side of Chicago. So they're living in the very communities where all the violence and trauma is occurring. And of course, they're in need of intervention many times too. So a lot more we could say about that. But clearly, we are calling the people that we serve our friends and our family, our colleagues and our peers.
Nikki, I just want to give a shout out to.
Go ahead, Dr. Mason. Sure.
No, I just wanted to just give another shout out to Mr. Dew and the task force. It used to be called task force, but that goes back to my days at CDPH. But I just want to also say the tremendous work that was done by these groups during the HIV. A lot of people forgot about HIV, but HIV was a scourge back before we had before we had medications to treat and actually good rapid testing and all that sort of things. But these were the brothers and sisters that were right out there trying to identify when people wouldn't sit next to somebody that if they start losing weight, they wouldn't sit next to them at church. So I just want to make sure that we don't, and I know there's a lot of other things that your brothers with the organizations have been doing and providing relief for those emergencies when you have a child, a teenager that's gone berserk. So I just wanted to put that out there because I never want anyone to forget the tremendous work that was done in the during the HIV era that many people don't even know about.
Absolutely. And if I may, Dr. Mason, thank you so much for bringing that up because my colleague Joel also referenced, our predecessors, Larry T. Bird, who's the first CEO of HSI, and Dr. Vince Bateman, first CEO along with Doris Lomax at HRDI. And those brothers were laboring in the vineyard. I mean, they were making it happen during that HIV/AIDS epidemic. And I mean, Dr. Dr. Bell took the effort all the way over to South Africa, and worked with UIC. I mean, these are the types of brothers who, we were observing, learning from, being mentored by, before we took our respective roles. So, this is, again, a passion for us because we've seen this being passed down generationally. And, oftentimes we forget about the fact that the community-based organization, which is that is in fact Black-led, has been in crisis itself and going through a traumatic episode. So now we're starting to describe ourselves as historically Black-led community-based organizations.
Well, Dr. Miller, I can read your mind. I can read your mind, Dr. Miller, so go right ahead. Unmute yourself and go right ahead.
Yeah, I just wanted to, jump in and say that, I do appreciate the work that these brothers are doing, and also to express the need for even more work of that type of work to be done. We need more mental health care workers. We need more opportunities, and we need something that's beyond that, which is we need a better educational plan for the community, so that people, I think in a large part of the community, we're still dealing with people either being ashamed or being, just feeling that that there's something different about them, in the sense that that they refuse to understand and accept the fact that they may need, or they do need, or misjudge other people that need mental health care. And these are just so important, just as important as you need your blood pressure medicine, and sometimes even more important. And so, so we really need a great and an educational program for our community, just with all the various groups, whether it be the church, whether it be whatever groups in the community, to really stress that these are things these are problems that need to be addressed. There's nothing to be ashamed of. They're illnesses, and that's if you don't feel ashamed to have high blood pressure, then there's no reason for anyone to feel ashamed about anything else that they can't control, but the need to be treated and need to treat the people so that these traumas that people are experiencing, it's tremendous in terms of how it exacerbate things that are going on. And I, just remember, during my practice, how, people would be doing fairly well, under control, and suddenly something would happen. Either they stop going for their treatment, stop taking medication or whatever, and suddenly they're out of control, and either, cause them to get into events and things that can be life changing for them, and not in a good way, but in a bad way. So this is so important in our community. We're not going to solve the other issues if we don't solve all the healthcare issues, and that's a tremendous part of the problem.
If I may, real quickly, Dr. Miller, thank you so much for your comment. Let me just highlight real quickly that in the state of Illinois right now, the healthcare transformation collaboratives have been launched, and this is set up to address healthcare disparities and to deal with the disproportionate access to care in many of our Black and Brown communities. And for the first time in my professional career, it's really just mind-boggling to see the extent to which medical providers are working with behavioral health providers to hire folk from the community. Wow. As community health workers, as peer specialists, as certified recovery support specialists, providing opportunities for folks who are reentering society. I mean, there are all kinds of opportunities out here for folks to be a part of the healing process as opposed to hurting each other and hurting themselves. Yeah. So much of this has to do with education, and we want healthcare around mental health, around substance use, opioid addictions, et cetera, to be a movement just like civil rights. We want folks, more and more folks, to really join arms and say, look, it's time for us to care about each other, lift each other up, and stop the madness.
Really?
All right, well, Sandra Brown says good evening. I'm sorry, what'd you say, Dr. Miller?
No, I was just saying I applaud that, and because that is so needed. That is so needed. Yeah.
Yes, indeed.
All right. Well, Sandra Brown says good evening. Lloyd Schneed says amen and good evening. Linda Johnson says stigma. She's talking about that stigma that we have when it comes to mental health and behavioral health. I just think having a little therapy is a little fashionable. So if you need a little therapy, go get a little fashion. Go on, sit there with your new shoes on and talk to a therapist so you can get through the day. And Gwen Butler says, my mom died of complications with HIV and AIDS. She was addicted to heroin and she died at age 47. And just the work that HSI and TASC is doing just around HIV and making people aware and letting you know that, there's a new day when it comes to having those type of diseases, lets us know that we can go forward. Linda Johnson says, my condolences to you. And I think she's saying this to Gwen Butler. She says, my condolences to you in the loss of your mom. It is so sad. It is so sad that there was stigma such that it is so sad that it was such a stigma in HIV and AIDS, and that kept people from getting help. It kept people from getting help. Can we touch on that a little bit, Dr. Mason, from the public health perspective, how that kind of kept people from getting help? And Joel and Donald, if you guys can kind of reach into that.
Well, all I can say is that during that time, we didn't know much about this disease. I'm talking about back in the early 80s or mid 80s. We didn't know what it was. We just knew people got sick, they got thin, and they died. And probably not quite that way, but that's what it was. And when this disease came out, you didn't really have any treatments for it. And some of the early cocktails were more than 20 different medications, and sometimes had more toxicity than the disease itself. And then we had stigma because it was associated with the gay community. And so, I actually saw in certain places that I went where people wouldn't sit next to certain people if they thought they identified a certain way. Or people found out that somebody did have this, or maybe they didn't, they just had cancer and they were thin because they had cancer. But it was really a very, very bad time. And I just want to say, and I don't want to take any much more time, I just want to say that HIV is still here. It is not we've got better treatments, and it makes it easier for people to live longer and normal lives, but it's still here. We shouldn't act like it went away, because the behaviors that spread it then are the same behaviors that spread it now. And I can't, I think about the folks from all the different HIV agencies, of which Task Force and Donald, you guys are all part of it, doing things, going through the parks at night and developing innovative ways to try and reach people, to at least get them tested. Because you got to remember, there was a time we didn't even have a test that could be done outside of a medical facility. It was a lot, and I was grateful that we had such brothers like yourselves and the dedicated people that you guys hired, because that was tough work, real tough work to do, to deal with HIV at that time. So I applaud you, and I never could. And I was at the Chicago Department of Public Health as its commissioner at that time, and got to know a lot of the groups that were out there trying to do a lot of this work. And thank you so much.
And I'm curious, Mr. Johnson, since you were screening, assessing, and referring, have you seen any change in terms of perception of getting help? Have you seen any improvement, or are we still kind of fighting the same battles we've had in the past?
We are still fighting some of the same battles. I mean, of all the lessons learned from the HIV epidemic and crisis in the 80s, and Dr. Mason, my mother was a high school counselor, but she brought the first comprehensive school-based clinic to DuSable, wrote the sex ed curriculum for CPS in the 80s during that time. And so HIV was a big part of, she went on to work in family life for CPS, but African American AIDS Network and all those organizations at that time, she was involved in that. Stigma still is a big problem. Addressing, tying this back to mental health awareness, stigma is a big issue, right? And even in the medical community, as a part of my work at HRDI, I facilitated a merger with the Federally Qualified Health Center, Friend Family Health Center. So we created the largest community-based integrated model of care, and still working with physicians on the seriously mentally ill, integrating them into a clinic setting. We got pushback, those people, and we're not sure who your clients are. The patients are the same people. They just come to you for one reason, and they come for me for something else, or they should come to you for something else, and they're not making it there, which is why we merged. We created an opportunity to treat the whole person. And so there's stigma across the board. We don't want to tell our family and friends that we're feeling sad, or that we're hearing voices. And so it is the fear of someone looking at us differently that stigma is the number one impediment to people seeking treatment. The number two impediment was cost of care, but the Affordable Care Act really did help improve that. But we still got to get people to use the insurance that's available to them, and to try and overcome the stigma. And so we work with, their campaigns, and there's a lot of money on the street for mental health and substance use disorder. It's a matter of using it and helping people understand that it's okay to need help. Like Nikki said, it's fashionable to be in therapy. In some communities, that's true. Black and brown communities, we're a little bit harder on each other, and we discount how people feel, or that's just a special uncle, or those types of things. And in fact, mental health and substance use disorders are the only real chronic illnesses that are discounted in a way by the profession, by the medical profession, and the community, that we don't treat people with diabetes the way we treat people with the mental health, with schizophrenia or bipolar. We don't treat people with heart conditions the way we treat people with alcoholism or heroin addiction. And so we have to come to terms as the helpers with how to really, what bedside manner really is, and how do we engage people. The use of peers is a huge way of connecting with people that we just don't understand, right? The peers that we've helped, that have found recovery, understand. They know how to talk the right language and engage people so that the professionals can help them. And then the other part of that, even Donald kind of alluded to it, is the people that we employ, especially coming through COVID, compassion fatigue. You know, who's helping the helpers? And so we're very focused on keeping people well and making sure people don't catch COVID and making sure they still get their treatment. And I lost so many. I have 60 open positions right now, and I just have turnover. People are burned out doing this work, so their own mental wellness is at stake. And we're seeing a lot more people take control of that in one way by leaving these jobs. Hopefully they're getting the treatment that they need, the support that they need, and not just hiding. But stigma is still huge, and how we respond to it, both professionally and from a community perspective, is still a challenge.
Absolutely. Let me
This
just quickly.
conversation is such a great wealth of information. It is such a great wealth of information, and we have so many questions coming in via text message, some anonymous questions and statements here on the comments. It is just a wealth of information, but in this information, there was a message. So I don't know how many of you guys saw the movie with the Wayans brothers drinking juice in the hood when he would jump up and say, message, message. Joe Johnson just said there are 60 open positions at TASC. Message for people who are looking for a job. TASC has, I'm going to say it again, 60 open positions.
High school diploma. High school diploma.
High school diploma, 60 open positions. Is a high school diploma the same as an equivalent as a GED?
Yep.
Okay, 60 positions. Message, are you guys listening? Here's some job opportunities right at TASC. Wanted to put that out there. You know, Lloyd Schneed, I'm sorry, I'm here. Lloyd Schneed has an outstanding question. Right before I read his question, I want to read an anonymous statement that came in. He says, this is not a question, it's a statement. I miss my doctor. I was a patient of Dr. James Miller for a number of years, and I wish that there was something I could do to bring him out of retirement, for there is no doctor like Dr. Miller. He took time to listen to his patients, and he even asked us mental health questions when we would go for each and every visit. I would never forget. I would go for my blood pressure medicine, and he would ask me, have you been feeling depressed? So I want to tell you, there is no other doctor like James Miller. Thank you for reading my statement, but also read, you are worried about HIV. People are living longer with HIV than COVID. Please get vaccinated. All right, sir. Thank you for that. He is absolutely right. What's the difference? COVID is the package now, not HIV. Lloyd Schneed says, is Black on Black crime rooted in mental illness? Outstanding question, Mr. Schneed. Thank you so much. Guys, attack it.
Well, you know, first of all, let me just say that that's not a simple response. I mean, there are so many different factors that are really ideologically based in terms of crime. I mean, you know, some folks want to equate, for example, poverty and crime. And yet we know growing up on the west side of Chicago, we were in poverty, but it wasn't this much crime. So we can't automatically say that just because you're in poverty is automatically going to relate to crime. But can I say that? You know, we know what the situation was like down south on the plantations. We were dirt poor, sharecroppers, and so on down the line. But there was not this level of crime. So we can't say that poverty is necessarily the root. And yet, you know, Dr. Joy DeGroot talks about post-traumatic slave syndrome and generational trauma. And the fact that now, epidemiologically speaking, there are opportunities for us to have DNA traits around these behaviors passed down genetically. I mean, if this is indeed the case, then let's look at all these different factors, especially something called institutional racism. Okay? I mean, when folks continue to talk about what's wrong with Black folks and why there's so much crime, I say, hold the deal. Let's ask a different type of question. Let's please ask what's right with Black folks, that after 400 years of generational trauma and terror, that we are still here having this kind of forum. Okay? We're not at each other's necks. You know, we're not shooting up each other. We're having a professional forum trying to uplift and to continue to inspire our folk to have a better opportunity. When Jesse Jackson said, keep hope alive, he was trying to say, don't give up. Don't have a sense of apathy. Don't give up. When Martin Luther King talked about, see, I can quote both Q's and alphas. You know, when Martin Luther King was talking about, we got to have a fierce urgency of now, he was very clear about the fact we've got to be urgently addressing the issues and ills within our community. So there are a lot of different conditions that really relate to crime. Yeah, are folks desperate? Yes. Are folks in pain? Yes. Are folks having some psychiatric illnesses? Yes. Are people not engaging in a type of appropriate self-talk? Yes. And what do I mean by that? I tell my folks in recovery, my friends, my family in recovery, all the time. Yeah, we can talk about the 12 steps, and yes, we can talk about one day at a time. But the most important thing to do is to master the moment, to make a conscious decision, a conscious choice in the moment that you're going to be victorious and not a victim. You're not going to create a victimization experience for anyone else, and you're not going to create that victimization for yourself. You're going to rise above and continue to talk yourself up, not down. Now, I'd be remiss if I didn't try and give just one opportunity for folks to practice a little bit of the preaching, right? And what is that? Drink your tea every day. What tea are you talking about, Brother Dew? Your thoughts, your expressions, and your actions. Think, express, and act. Half the battle in life is what comes out of the mouth and what goes in. That's half the battle. Think about mastering that moment. You master the moment, you master the crime, you master a lot of the ills in society, and we get a chance to once again rebuild the social fabric, because the number one agenda is to master self.
We need to bottle you up and present you to all the brothers and sisters who need to hear this, because I think some of the problems that we face is rooted in not having a voice like yours in the home, not having a voice like yours in the school, and most importantly, us not being able to recognize the struggles that people face, and just being able to meet people where they are and hearing them with clarity so that we can help them with clarity. And I just think that we struggle with that, and we just need more clinicians, more people in social work, more people who are able to have that face-to-face to be able to really make sure those people are heard. And we have to make them accountable at the same time. Like I'm not a softie. We're going to make you accountable, but we're going to hear you and understand what your struggles are. So I really think that's really important. I wanted to throw up some additional comments. Many from Sandra. Many have blinders on when it comes to mental illness. It is so necessary to address in our communities in order to heal our community. Many of the crimes we perpetuate as a direct result of undiagnosed mental illness. And if our communities are so afraid to even accept that this is a real thing, then of course a lot of people have those hidden traumas. And then you got to add to that, in communities of color, they have the micro traumas of daily life. Man, I tell you, just being a person of color in this world. And sometimes I learned recently, when I was in college, my Jewish, in medical school, actually, my Jewish friends were like, I got trauma too. They treat me funny. You know what I mean? So a lot of times you have to be open to that as well. Other people are dealing with trauma, and we have to figure out how to manage through our lives in spite of that trauma. And then I want to throw up one more comment here. You want to go ahead, Nikki?
Oh, I had a micro trauma getting home to actually start up our program today. I had some road rage on that expressway, trying to get from the south side to get here inside. And it teaches you how to actually, you need to take a minute, breathe, and get better. So yeah, micro traumas. Linda Johnson says, Dr. Mason, you're so right, because some people's T cells are undetectable. People are becoming so lax in their behavior. We see that our congressman has made it in and made it on to our program. I did tell you that he would be running just a little late, and he is here. Of course, May is Mental Health Month, and we have HSI and TASC here giving us information and awareness on mental health. Denise Campbell says, for some reason, the Black families look down on those who suffer from mental health issues or addiction.
Mm-hmm.
Let's discuss addiction a little bit. What are we looking at when we talk about addiction? Dr. Miller, you're nodding. Go right ahead.
No, I'm not. Yeah, I'm not nodding for that reason. Actually, I was going to, one of the questions I was going to, issues I was going to raise was, despite the fact that substance abuse or substance issues are a huge problem in our community, the ability to get folks treated is still a lot of difficulty. I mean, because sometimes these are issues that need to be taken care of when the opportunity arrives, when the person decide. Because when that window opportunity is open, if you give them a couple of days, it goes away, and then therefore it becomes sometimes more difficult. So what is going on, or what is being planned to try to figure out how we can better spread the availability so that people that do have substance issues can be treated a little bit, treatment can be more accessible to them?
Yeah,
Go right ahead.
sure thing. First of all, I think we should recognize that there's this thing called parity, right? Where we want equal access to care, equal payment for services. And unfortunately, one of the impediments to access for behavioral health treatment, mental health, and substance use has been the underfunding of the services and a disinvestment in the creation of a workforce. So we have a workforce shortage. I have 60 jobs, right? And so all of those jobs are would-be counselors. Those are 60 counseling positions. So my ability to, and we have a small treatment program, but my ability, if I had 60 credentialed counselors, then they could provide more treatment, Dr. Miller, to your point. And so it's not just me, and across the state. So there are waiting lists. I called a program the other day in the south suburbs trying to find a bed for a family friend, and their waiting list is closed. Right? They're not taking referrals right now. So there's not enough workforce. There's not enough professionals in the field right now to service the need. And I want to remind us all that during the last 18 months, 24 months, when people, especially the early part of 2020, as people shut down and were isolated, anxiety was on the rise, depression, substance use, alcohol sales went through the roof. In April of 2021, for the first time, legal marijuana sale tax revenue surpassed alcohol tax revenue. So think about that. Marijuana sale hadn't even been legal. Marijuana had not been legal for longer than a year. And in a year's time, the tax revenue generated from marijuana sales exceeded the tax revenue in Illinois for alcohol sales. So there's a lot of legal marijuana going on. We know that the illegal marijuana industry did not go out of business. And so if you can imagine how much mood altering substances were being consumed as people cope with this new reality of COVID shutdown, and the mental health consequences of that same isolation. Even introverts need contact, right? And so, yeah, it's a lot going on, and I'm happy to say that our General Assembly passed a substantial rate increase for substance use disorder, a 47% increase in funding. That's going to go into jobs. That's going to increase salaries. Hopefully, we start to develop a workforce, but unfortunately, it's going to take a while to more social workers, more therapists, more psychiatrists. It's going to take years for us to build a bench to really make an impact, but we're going to take what we can get day by day. Hopefully we can recruit some of these people back to the field who left, but utilize peer support services best we can, and paraprofessionals to help plug some of the holes. But we have a workforce shortage for sure.
But the real deal too is, how do you help people not become addicted or reach the point where they don't need something external to themselves to be able to cool out? I just came from a great event, and first thing I saw was about 50 bottles of wine. When I got there, I'm saying, before I walked in the door, the red was over here and the white was over here. Now, I didn't want to drink any wine, but since everybody there was tasting, I didn't want to walk around with no glass, nothing in my hand. So I got one, and since I had it, I figured I may as well take a little sip. And so I guess what I'm really getting at is how do we help people? I say children because these are the most formative years. But how do we help people? I think the reason I've never been addicted to anything to drink, and I used to smoke cigarettes. I smoked them like a chain. I'd have 2 or 3 packs everywhere you go. But then I managed to get away from that. Alcohol and other kind of drugs, I think I've never really gotten into those because I always said to myself once I reached a certain point that I wanted to feel like I was in control of whatever I was doing. And I just didn't want something else controlling my actions. So, can we help children, especially, reach the point where they don't feel they need something outside of themselves to make them happy? I mean, we used to say all I need to make me happy is 2 little boys to call me Pappy. One I'll name Biscuit, and the other one I'll name Gravy. And that had to do. But I mean, how do we help people do that?
Well, Congressman, I think you answered part of that question. Make sure they got some biscuits and gravy.
I don't know if that'll do it. That did it then. I don't know if that'll do it now.
Sure. But let me say, and I'm so thankful for your question and you know, and putting it out there in the way that, you know, fundamentally deals with the notion of what can we do in real time right now to help folk have a little bit of optimism for a better day. I mean, the first answer to me is purpose. Folk got to have purpose. They got to have a reason to want to do it. I mean, when you're living in an existence that is so apathetic, so hopeless, so meaningless, like you don't count, you don't matter. I mean, that whole notion of like Black Lives Count. Well, you know, Congressman, we're putting that message out there for the census. Not only do you count, but you also matter. So let's make sure you get counted, right? And one of the ways that we demonstrated to people that they mattered, that they counted, was we stood in the long lines with them to get food. We stood in long lines with them to get the PPEs. We let people know that, look, we're going to stand out here with you. And we gave them a bag with information about the social services, behavioral health services that we provide. And said, look, you know, yes, we do care about you. And here's the other thing that happened that I thought was very, very interesting. We had over 20,000 people that were referred for basic human needs. Anytime you look up and see people standing in long lines with Reverend Harrell, with Black Men United, standing in long lines just to get food, that tells you about the level of desperation that people have. So we got to give people something to feel hopeful about. We got to give them a sense of purpose. We got to give them something to feel energized about. So I was observing this lesson, and I got to go back here for a minute, Congressman. Back in the day, when someone by the name of Danny Davis and Nola Dew as community organizers formed the Mile Square Federation over 50 years ago, and they were able to start getting folks employed as community health workers. Now, I'm telling you, I'm a witness to what that did for the self-esteem for Black folks on the near west side of Chicago, walking around the community with health bags, going into the Henry Horner projects and other projects, doing health screenings, and having a level of self-esteem and purpose and being totally community engaged. So when you get this kind of purpose-driven life experience, your children look up to you. That's right. I was looking up to Danny Davis and Nola Dew and all the rest of the folks at that time. And I'm like, yeah, I could see what they're doing. Joel Johnson was looking at his mama doing HIV/AIDS, you know, counseling and services. My mom went on and did venereal disease coordination. So it inspires folks. It lifts folk up. The kids, the children get a chance to see and look. Congressman Davis is working with the prisoners, working with the fathers, trying to get them to reconnect with their children. Why? Giving them a purpose to come back home and get engaged with their families. The children look at daddy who's incarcerated or mama that's incarcerated, and now they feel encouraged. They feel hopeful. They want to be a part of something powerful. They start to say, I hear you, Dad. I don't need to go to prison. Just because I'm in child welfare or just because I'm in juvenile justice, it doesn't mean that it has to be a pipeline into the adult criminal justice system. I got hope for a better day. I'm going to do something different with my life. You know, Bernard Clay over at Introspect Youth Services, thousands of folks going to college, giving them hope. So my thing is ultimately you got to give our people some hope for a better day. If you don't give them the hope, if you don't give them the tools to work with, if you don't give them the ability to control those urges, I say that anything you can't say no to is an addiction. Anything you can't say no to is an addiction. So therefore, aspiration without self-discipline is ineffective. So when the congressman talks about, I didn't want anything to control me like that, I hear you 100% on that, Congressman. And that's the way we need to begin to think and talk to our children first, because the seeds are planted early. And as they practice early and meditate on these principles of life and living early, then they grow up with this and they understand it and they retain it. That's just part of it. It's not all of it, but that's just part of it.
Yeah, I say amen to what you're saying, Brother Dew. And I think that also we have to, when we talk about hopeful and about bringing other alternatives, I think we got to look inside for some answers as opposed to looking for someone to bring the answers to us. I mean, we got to have a better relationship with each other. We have to show more caring towards one another. I think that, you know, there's some things, whether it should be done from the outside or not, it isn't the question. The question that it's not going to be, and so we can't wait for the cavalry to come because it's not on the way. They're not planning to send it. So we need to begin to form our own cavalry and start dealing with our own issues, which is showing care and love and developing some unity and those kinds of things. I mean, you know, people, sometimes do substance not because they want to have fun, but because they can't deal with the pain and they can't bear the disappointment that they're having in life. And so we have to be, or they're afraid to go out and to deal with what they have to face outside or inside as well. So we got to begin to look at those things, and that's where the real healing is going to occur, when we begin to look inside and figure out how we can do something and not be dependent on someone who don't have an interest in that.
Absolutely, Doctor. Let me also just quickly say, you know, so much of this is in the messaging, right? You know, so for example, you know, I remember before we went to bed at night, there used to be a piece that came on after the news that said, it's 10 o'clock. Do you know where your children are? Mm-hmm. Now, one of the superintendents from police said a child should not have to die because they cry. Okay. Another person came along and said 3 shots to cure VD. I remember that. All right. It's the messaging. And now, you know, so many of our athletes and celebrities are doing what? They're talking about mental illness. We got Jay-Z, we got Taraji, we got Kiki, we got all these different folks saying, I don't feel right. Some ain't right upstairs. So the more we can begin to express to our children, it's okay to seek out treatment. It's okay to talk about it. You know, we got the Generation Z folk out here. Congressman, we had a mental health ambassador group of young folk just coming out of high school and college. They were talking about their experience with suicide. Their friends committing suicide, who they're going to college with, who had pledged with, sororities and fraternities, who committed suicide. We've got our first responders committing suicide. Folks are in a desperate, painful state. So we got to find a way to create some relief. And a lot of it is in the messaging. We've been talking to our county officials, our state officials. Anywhere anybody goes is waiting for a public service ought to be getting a message on the screen about how to handle stress and get rid of that mess. No drama and no trauma.
You know, Donald, thank you so much, man, because
all right.
That's right on point. That's truly right on point. But the other thing I wanted to add to that is we cannot leave out the contextual history for how we got here.
Yes.
You know, and so we sometimes in our analysis, you know, when as a physician, you always have to do a proper history. And some of that history involves not only the patient, but involves what's called a family history.
Yes.
And when we look at where we are today, if we were to do a family history, you know, I grew up not on the west side, but I grew up on the south side in Inglewood.
We're not gonna hold it against you.
No, that's all right. But it was true on the west side too. when older people felt safe sitting out on the porch. And if something was going on, they say, son, what's wrong?
Yep.
And they'd ask you to come up on that porch, sit down here and talk to mama, tell mama, because sometimes that mama wasn't your biological mama, but you know, she or he performed some of these other things. And that loss of extended family and real community, to get back to Dr. Miller's point about the love, that's what it really was. We did care for each other. And we knew that, and everybody on the block knew that every child on that block was their child.
That's right.
And actually, in those days, they gave them license to treat them that way too. If they saw them step out of line, they could get self-corrected immediately. So there are a lot of things. And lastly, I want to say that one of the elephants in the room, and I'll stop right here, is we still have the vestiges of the successful implementation of the global white supremacy strategy. And that strategy is causing a problem all over the world of people of color. $10 billion industry now in skin bleaching cream. Today. Not before, but today. Still, yes, sir, right now. $10 billion in skin bleaching cream is being sold all over the world. In fact, I won't say what country they were from, but I overheard these ladies who had just come back from London buying this high quinolone concentration, Dr. Hampton, of these skin bleaching creams. And they were just thrilled to death, and they got back to their home and were sharing it with other people. Now, we still have to deal with self-negation. And these are the things that also have to be part of the menu of how we deal with mental health, because one of the things we had coming out of the 60s and 70s was this whole emphasis toward Black love and Black pride.
Right.
And nowadays, I'll close by saying that I don't know what the hell these kids are getting on their tablets, because their tablets, their phones are raising them.
Yes.
When they had on Channel 2 about how these kids found out about carjacking, how to get a gun, the young man said, I could get a gun off of Facebook. The young man said, I watch what's the drive-by shooting kind of video. And I'm not saying that's all of it, but we have young, impressionable people who are now, in my way of thinking, addicted to these devices. And they are becoming one of the primary sources of misinformation.
Yeah.
Yes.
I guess
Go ahead, Congressman.
Where does it begin? I'm saying organizing is essential in terms of helping people. You know, Deacon Burden from the Victory Travelers just died. And he was a fellow that happened to be a good friend of mine. I can't sing a lick, never couldn't carry a tune. But one of the reasons I liked him, he and another guy fellow named Bossy Morris. Bossy used to sing too, Bossy went on. But they were part of organizing quartet singers. And so anybody that's organizing anything, because I think that being organized is so potent. And so I was a good friend of both of theirs, but not only because of their singing. You know, a lot of folks sing good, but they're organizing. When they would be trying to organize the Chicago chapter and keep it going of quartet singers. And if people could be organized, I don't care whether it's block club, I don't care if it's child parents, I don't care if it's Little League baseball, I don't care but if individuals can be organized, I think that put people in a place where some of these principles and practices can be disseminated and people pick up on them. I don't know any other way that they really get them, because the cow is already out of the barn. And so we gotta somehow or another try to corral the beast. I'm trying to figure out how to push this concept that the lyrics in these songs and all these things, even though I'm a First Amendment person, I'm a big time First Amendment guy, but I get scared when I listen to some of the lyrics in the songs and all that are being broadcast, and the language that people use in promoting what they do. And I don't want to stop people from speaking out and saying out and whatever out, but I do believe that there ought to be some sense of decency in terms of what our children are able to hear and buy into. And what gets me the most about the language is that boys always slipped and said stuff and all, but young girls are just, I mean, they are, oh, they're atrocious. I mean, sometimes I be in these stores where they ban, swishers and whatever that stuff is they smoke, and they'd be where they'd be talking. I mean, so let me get out of here. That's a beautiful young girl. But Lord, the stuff that's coming out of her mouth. If I was in the dating business, I don't believe I don't think I'd want to take her home to be mama. No, I just wouldn't. So it's tough.
Yeah. Congressman, I think that one of the
it
is that we need to make certain that, I mean, there are a lot of positive images, and there are a lot of that are in our community. However, it seems that a lot of these negative images seem to have a higher voice. And the youth is very impressionable, and they tend to go in directions of what they hear. And so I agree with you that we need to organize. I mean, a lot of things that were happening in the community years ago was because there was a lot of the positive image on stage. I mean, men were more interested in the youth. They're organizing, like you say, baseball, basketball, softball. Now what I see is kids just playing there. There's no supervision. It's just a bunch of kids. And but we gotta, it's gonna take some of that kind of involvement. I know we need to, I call it, we need to invest, but we need to invest our best, which is us. Our money is good, but nothing is better than what ourselves, our time, with what we have to invest in our youth. And without that, if we're not willing to invest that in our youth and give them us, give them our time, then we're not going to be able to change the behavior, because somebody else is investing in them. And they're investing in them maybe for other reasons, but they're investing in them. And so it's going to take an opposite kind of effect to counteract the thing that we don't like. So if you don't like something, I was always told, if you don't like it, then get up and do something about it. And that's what we have to do. We have to get up and organize ourselves to be a positive influence and make certain that we're there for these young people, and that they see us, that we communicate with them, and that we mentor them, so that they have an alternative to see. There's an old saying that if you dig a hole and you don't put something in it, it'll collect trash. And so that's what's happening.
Absolutely, Dr. Miller. Absolutely. You are absolutely right. Gwen Butler says, I suffered from depression in the past, My husband served in the military for 34 years, and he still suffers from PTSD. People think depression is sadness, that it is crying and dressing in black, but people are wrong. Depression is the constant feeling of being numb. It's being numb to emotions, being numb to life. You wake up in the morning just to go back to bed again. Lloyd Smith Sr. says, no voice like Donald Dew, like Dr. Dew are heard in the communities. Victor Ramos says, as an immigrant, I endure pain enough to become depressed because of the hate my family suffered, the brutality of bullying. Praying is the most important way out. Thank you for this conversation. Sheila McKay said, greetings, everyone. Linda Johnson was probably laughing at the congressman when he was talking about that wine because she also said, Congressman, was that a little peer pressure? And Sheila began to laugh. Linda Johnson says, I hope we can, but parents have to be careful about getting high in front of their children. Maybe she's saying it appears to be fun, but what I see is that young people think alcohol is associated with a good party and a good time. Sheila agrees with her and says she's so true. And we have so many comments and questions that are coming in. Kimberly Dew says, my mother always said, we're sum of the total of all we say is yes. So there are so many great comments going, and they're trending, and we're getting your questions. And I know there are so many, and I can't read everybody's today because I'm about to say that sentence I'm about to say that sentence that nobody wants to hear, and that is, we're at our time. We're actually over our time, and it's okay because the conversation has been great. You know, I want to invite back TASC and HSI, that's Joel and Donald Dew, if you guys have time on next Monday, to come back with us. We will also be joined at that time by Henry Taylor of Miles Square and Vicky, and they want to have a conversation about suicide in the community, suicide in our minority communities and those numbers. So if you guys have time, I would love to have you back with us on next Monday. Remember, May is all about mental health and behavioral health. So we want to make sure that you guys are here and here with us. As we always do, we go around this table and we say our final thoughts that until next Monday when we ask you. My until next Monday today, I'm going to remind you to wear your mask, wash your hands, because coronavirus is still here. Miss Rona is not playing. She is still here and she is real. Doug, you're until next Monday.
Well, I want to say that what Dr. Mason said brought back some memories for me of the 1980s. And that great science takes time. In the 1980s, I was working in the cancer clinics, and that's where we saw the AIDS patients because they had an illness called Kaposi sarcoma, and they died rather rapidly. And if you were to ask me this many decades later, if people I thought would be living and enjoying their lives with unmeasurable levels of HIV, I would not have thought that possible. So the meaning of this message is when you hear all this stuff about COVID, understand we're just at the very beginning, and the good science is going to take time to get us to a workable solution. So I just say hang in there, but give us some time.
All right, Dr. Miller, you're until next Monday.
Yeah, my until next Monday is, let us in the community work on unifying our efforts to make for a better outcome. Let's love our children and show them that love. And last, I would just want to say in advance, happy Mother's Day, since next Sunday is Mother's Day. So we want to say happy Mother's Day to all the mothers that are out there, and hope the whole week is a good Mother Day for you.
Outstanding. Dr. Terry Mason, you're until next Monday.
Until next Monday, think over everything you heard tonight. There's been a lot that's been talked about. And then search yourself and your own family to see what you can do where you are with what you have. Because the solution ain't coming. The cavalry ain't coming. Ain't no cavalry coming. We it. And if we don't do something about it, ain't nothing going to be did. Pardon my poor use of the right words. And I thank you all for listening. And I thank you, Donald, and you, Mr. Johnson, for what you guys do every single day. And for all the people that you see that never turn around and say thank you, I'm going to say thank you so much for what you do every single day and been doing for a long time. And may God give you the strength to keep doing it.
Come on, Bishop. Come on. Bishop, take us to church. Take us to church, Bishop. We got an outstanding Calvary. Once again, I have a message for you. Message. TASC has 60 jobs available, 60 open positions at TASC. All you need to have is a GED or a high school diploma to begin a career at TASC. 60 jobs. For all of the people who are here trending in and sending messages and questions and comments, share that information. Let that post go viral. I want Joel's desk to be so filled with resumes and requests until he's farming them out to HSI and other agencies that here's some people that are capable of doing some jobs there. Donald Dew, you're until next Monday.
Until next Monday, Congressman Davis was talking about the music that our youth are listening to. Well, I just want to say until next Monday, listen to a little Earth, Wind, and Fire. Keep your head to the sky. Until next Monday, listen to James Brown talking about saying it loud, I'm black and I'm proud. Until next Monday, we want to listen to the Four Tops, Still Waters Peace. I'm not going to go through all of that poem right now, but we want peace in our community. But the bottom line is that we want you to talk yourself up, not down. We don't want you to be down and out. We want you to be up and in.
Oh, Dr. Mason, that's the assistant pastor of the church over there. That's Dr. Donald Dew, Bishop Dew. That's the assistant pastor at the church because he has taken us to church today. And we love it. We love it. Joel Johnson, you're until next Monday.
Yeah, I want to touch on something that was just said. So my until next Monday is faith without works is dead, right? And so I want us to pray to whomever you pray to, but I also want you to seek treatment. If you feel like you need to talk to somebody, you need an intervention, pray about it. Pray with your faith leader, but seek the professional treatment and hopefully your faith community supports that, right? Because so much of the stigma and the lack of intervention in our community, some of it unfortunately happened in our faith community. Some of it happened around the Thanksgiving table. So faith without works is dead. And I encourage us not to live, right? So we're not suffering with mental illness or depression. We're living with mental illness. We have lived experience, and recovery is there for all of us. And so recovery from mental health challenges, from chronic substance use disorder, from manic episodes, recovery is possible. And Donald Dew and I and others and some of the physicians here, your doctors, talk to them about opportunities for healing and health.
Outstanding. Once again, remember to join us on next Monday when we'll have special guests, Henry Taylor and Vicki Webster. And of course, TASC and HSI will be back, and we're going to be talking about suicide rates in our minorities communities. Dr. Tony Hampton, you're until next Monday.
Definitely want to thank our guests for an engaging conversation, an important topic. And what I walk away with tonight is a few themes. One is that we have to put our arms around each other and support each other. Anytime you see a child that's doing okay, has that support around them, we have to be present. So, and guess what? It doesn't have to be your child, as was messaged by Dr. Mason. It can be the neighbor's child. It can be that relative that lives in Mississippi. You know, we need to put our arms around each other and give them a reason to wake up every day, give them a sense of purpose, give them hope. They need structure. They need somebody around them that's going to balance their lives and keep them on track. And I do want to, since we talked a little bit about the children today, I just want to remind you guys that our very own Dr. Jasmine Searcy Pate has a book. Now, why is her book important? Olivia Takes a Mental Health Day. It's important because it allows you to do two things. One, it allows you to have a conversation. It teaches you how to talk to our babies about mental health. But just as importantly, as Dr. Mason and others have talked about, self-bleaching. I mean, think about that. So her book shows beautiful children of color, and they're proud of who they are, how they look, and what they represent. So we want to make sure that our babies are proud, that they'll never even think about such a thing as a self-bleach, because all of us are beautiful, whether we're black, white, brown, etc. We're all beautiful, and we need to look at ourselves that way. So if we do that and our babies learn to have better mental health, then the next generation will be better, and the next generation will be better. So again, guys, thank you for this conversation. I really enjoyed it.
Thank you, Dr. Hampton. Congressman Davis, take us home. You're muted. You're still muted. There you go.
I'm okay. You know, since Donald Dew mentioned earth, wind, and fire, a lot of folks don't know that earth, wind, and fire helped start the Miles Square Health Center. Matter of fact, Dr. Verdine Adams was one of the original people in the community. And I noticed that I never heard Maurice White and those guys use the lyrics that we sometimes don't like. Of course, they grew up over in the Henry Horner projects, right across the street there from Miles Square. And so they contributed greatly. Great artists, great community engagement, great community involvement. And I was thinking of Farmer Brown, and the guy who wrote the song says, one night Farmer Brown said, take a little care. He locked up the barnyard with great care. And when he shouted, who there? This is what he heard. Say, ain't nobody here but us chicken. So the bottom line really becomes the problems that we talk about, the issues that we have, nobody is going to solve them but us. If somebody think that there's somebody else, I was just looking at a report that we had put together where my congressional district from HRSA since 2008 has gotten 66 billion 722 million 221,289 from HRSA for health care in our district. Now, of course, money helps. Blues singers say the best things in life are free, but you can give it to the birds and bees because we need money. We need money, but we need a lot of other things too. There should not be 60 unfilled jobs at TASC. And we talk about no opportunities a great deal. I mean, we said things would be all right, but we just ain't got no opportunities. And so it really means that comprehensively, all of these things are connected in a very serious way. They're connected. It's kind of like it used to be love and marriage go together like a horse and carriage. Brother, you can't have one without the other. Well, that ain't quite the deal now. But the real deal is that problems are just situations waiting to be solved. And people often talk about how tough it is. And yet we've heard all of this stuff. Life ain't been no crystal stair. And I don't think it's been that for any of us. I mean, there's nobody here that came in with a silver spoon. Everybody had to do a part. And so being honest, even when we communicate with people, that a big piece of what happens to each one of us is because of us. And the more we help people to know that, to try and become a part of the solution and not a part of the problem. If you can give the very best of whatever it is that you have in terms of talents, and we keep learning. I heard a sermon on Sunday where I had a different look at Dowden Thomas. That I was listening to Reverend Otis Moss III, and he described Thomas a little differently than the way that he said Thomas wanted to know some things, so he asked questions. He was, and it wasn't so much that he didn't understand what was going on, but he just wanted some assurances, and he asked a lot of questions. And so we have to keep asking questions. And asking questions don't necessarily mean you ain't with the deal. You're just trying to see what else is possible, what can be real, what can work. So until next Monday, I want to thank all of you for making this Monday the kind of Monday that it's been, filled with information, reality, realism, excitement. Every time I hear the discussion, I get another level of hope, another piece of possibility. And being an optimistic person like I am, I don't always think that things are just at the end. I think that they're at a position where they can be turned around. And that with all of us being as involved and as engaged, and I'm talking about people who might be listening, who might be viewing. I'm talking about people who themselves might have given up, and people who can express. I really had gone to a celebration of the Constitution of the country of Poland. And one of the reasons I wanted to make sure that I was there, I wanted to be able to convey to the Polish leadership in this town that I have a great deal of affinity for their country in terms of how their country has related to the Russian invasion of Ukraine. That they themselves are a country that has had tremendous difficulty and was bombed to smithereens during World War II. And there are places there that have never been repaired since then. But they stepped up and opened their doors to the Ukraine citizens who had no place to go and no place to turn. And they said, here, come to Poland. our doors are open to you. Yes, we are jeopardizing ourselves because if Mr. Putin get mad with us and decide to turn, we don't have what we need either to be able to seriously defend ourselves. So I just really was late because I wanted to go to that gathering of Polish leaders, just as I would want to go to any gathering to say thank you for standing up, for standing up. So I want to thank all of you for standing up. Until next Monday, keep on standing. Have a good week, and we'll see you then. Goodbye.
All right, join us right here next Monday, same bat time, same bat station, Couch Conversations with the Doctors, where true health is wealth. Congressman, just want to say, hey, David Milner, your frat brother, is here, him and his wife, Dr. Milner, and they said great point, and they are here with you. See you guys next week.
Everybody needs a podiatrist.
Yes, she's an outstanding podiatrist.